Don't think healthcare professionals have any business experience? Think again. No topic is off limits as we share tales from our brave hosts who will always tell it like it is. We are #NoFilterHealthcare. Here to guide you through your healthcare journey are your hosts, Taylor Dunn and Tamara Dhanda. We want to thank our sponsor, Uptime Health, the leading healthcare equipment and compliance management software company, for bringing this podcast to fruition. Visit uptimehealth.com to learn more. Let's get started.
Welcome to #NoFilterHealthcare. I'm your co-host, Taylor Dunn.
And I'm your other co-host, Tamara Dhanda. And today we have our guest speaker, Ian Prendergast, co-founder and CEO of Toothio.
Hey, Ian, how are you?
Good. How are you guys?
We're good. Thanks for joining us today. First of all, I've told you this before. I'm going to say it again. I love the name of your company. I think it's so much fun. I definitely want you to tell us how you came up with the name of your company, but also about yourself and how you started Toothio.
Yeah. It's funny. It's hit or miss. Some people absolutely love it, and then some people in the business world are like, "How did you come up with that name? I don't understand." It's funny. I think the industry loves it though, which is great. All the feedback we get is positive. But so it's kind of funny. So Toothio came about originally after a day of snowboarding up in Breckenridge, Colorado, with my co-founder Devin Cox. We both have a background in labor marketplaces. We were both at Quick, which was a labor marketplace for the hospitality sector. We scaled that to about 35 markets across the country. And one day we were snowboarding, and we got done with snowboarding and sat down at a table at a restaurant for a beer after, and started talking about other industries that we've heard of that could utilize a labor marketplace or a gig platform like Toothio. And dental came up, and we had heard dental multiple times in the past. We heard that there was a massive labor shortage, a staffing shortage that was, not just going to be a short-term thing, but more than likely it was going to be a 10+ year problem. And we knew that we had the background to be able to come to the table and help solve that problem. And so that kind of kicked things off. We started talking about, the potential of starting a marketplace, a labor marketplace in the dental space, and helping doctors find staff on demand to support their patients and their practices. And then funny enough, about 2 weeks later, I was in the golf course, and I ended up getting paired with a doctor named Kenny Baker, who was a career doctor out of Denver, Colorado. Had 3 or 4 practices over the course of his career. And on the back nine, I had found out that he was a doctor, and so was the other guy that we were playing with. And we started talking about what I do, and I had mentioned the idea of Toothio to him at that time. And at the time, it wasn't called Toothio; it was called nothing at that point, right? It was just an idea. But I ended up kind of running the idea by him, and he thought it was a great idea. And then a few weeks later, we ended up putting together a panel of doctors, and they loved the idea, and we decided to start working on it. So it was kind of it was a weird kind of serendipitous thing, meeting multiple doctors after having the conversation, and so it seemed meant to be.
So what you're saying is it's kind of strange for you to be in your office right now, because it seems like you do work just outside of your office.
Yes, is the most of the work gets done on the golf course, exactly,
Yeah.
or on the ski hill, I guess.
No, that's really cool. So I want to kind of understand a little bit more about, there's other staffing companies out there, but like what makes Toothio different?
Yeah, so what we're doing is we're taking a very different approach to staffing, and we have in our previous ventures as well with Quick. My co-founders are ex-Amazon, ex-Uber. Devin was managing a team of 50 at Uber at 18 years old, and so we've really gotten this unique insight into how to truly build a labor marketplace. And there is a ton of nuance. It's some people think it's as simple as build a website and have people sign up and just connect them with dental offices. And that's just not the reality. The reality is, if you want to do it right, you have to build in a tremendous amount on the back end to ensure that the quality of the experience is excellent on both sides. Because our customers are twofold, right? Our customers are dental offices, but they're also our dental professionals. And so what we're doing is we're leveraging AI. We're also leveraging our algorithms in the background that are running to make sure that the quality of the experience is totally different and absolutely incredibly high compared to everybody else that's out there. So it's all the little things in the back end that nobody sees that actually makes Toothio as great as it is.
Well, I saw on your website that you guys currently vet your professionals before they can, work with you. They have to meet certain standards. So how do you determine those internal vetting standards?
Yeah, so that's a unique thing that Toothio does that nobody else does, right? There's not a single hygienist on our platform that hasn't been one-to-one vetted and rated before they even get on the platform. And then what's cool is once they've gone through that rating process and that vetting process, once they're actually active and able to accept shifts, we now have a rating system built in. So every time they work a shift, they're rated by the industry, the doctor, the office managers, and their peers. And so what we see is the great professionals start to rise to the top, and the ones that aren't great fall off. And so we have certain benchmarks with our what we call our Toothio score, and if they drop below a certain threshold, they no longer get shifts. And then we're also giving the practice the agency to be able to say, we really liked Jenna, for example, so we want to add her to our custom pool. And the goal is really to make this whole experience feel like we're not a temp agency, but we're an extension of your team. So as you work with us more and more, you start to see more and more faces that you're familiar with. And we have clients, especially here in Phoenix, that have used us, hundreds of times at this point, and they have a pool of, 15, 20 dental professionals that they see every time now. So they're familiar with how they operate their practice, what practice management software they're using, where things are, how to do things. And so we're really trying to be an extension of their team versus just a, temporary option.
That was actually going to be my other question is just, that review process after they've worked with a dental practice, how do you evaluate their experience? So it's an ongoing thing.
Absolutely. So the initial vetting is we actually have a team of hygienists that are doing the vetting, and they're handpicked. They come highly referred from other practices in the area that we've worked with closely that are high production practices, great offices, and they have a kind of a 15 question panel that they go through with every hygienist or assistant, and then they also take a quiz during the onboarding process, and that quiz pumps out a rating and then a score. And so they have a pre first shift score, and they also have a post first shift score, and that all gets aggregated after their first shift.
That's really cool. Do you guys offer like any kind of training for anyone that, like, let's say they're new to the industry and they really want to be a part of, Toothio and get business this way? Is that something you guys offer?
We don't currently offer training per se. We're really trying to focus on attracting the talent that's already trained and already proficient at what they do. And then from there, it's all about filtering out the ones that are great from the ones that aren't great.
Gotcha. Okay, cool. All right. Well, I think we've come to that time where we're asking the no filter question. We crack ourselves up because this podcast, we realized that everyone's pretty honest on this podcast from the start. So we don't even have to like preface this question like this anymore. But that's why we love it, is like everyone's here to just really be, they want to come forward with the truth about how they're running their business and how they've come up with their success and everything. But I want to press on this. So what is the potential impact of on-demand professionals regarding job security, given that these professionals are working under contracts that can be terminated without reason? How do you ensure the longevity of their roles and support them?
Yeah, so I think, what we do is really kind of on demand staffing, right? So hygienist gets sick and calls out, goes on maternity leave, goes on vacation, has an unfortunate accident, whatever it is, we're kind of in that on demand space. And so, from a job security standpoint, we have a surplus of jobs at this point. We have more demand than we have supply, right? Not by a dramatic margin, but we have a ton of demand, and we're working really hard on filling on the staffing side, on the professional side, right? That's the constrained side of any labor marketplace in this space, given the labor shortages that we're seeing. So I see job security from the standpoint of there's going to be shifts to pick up in every market we go into for a very, very, very long time. I think I don't see this as a 2 year problem or a 5 year problem or a 10 year problem. I see it as everybody we talk. This is a 15+ year problem from a labor shortage standpoint. And so there's going to be shifts for a very, very, very long time. And I actually see platforms like Toothio becoming a fundamental part of how dental offices run their practices long beyond the labor shortages. Even when things bounce back, even if things bounce back in the near future, I think just because of the experience that we've created, we're a tool that dental offices can leverage to be able to run their practices more efficiently, more effectively, reduce their overhead, and make sure they don't lose out on any production.
You'll have to forgive me because I'm new to this concept, and I think it's really brilliant. But I'm curious what the average time a Toothio professional spends within a dental practice. Does this ever get interpreted as like negative, or the turnover kind of experience with other FTs in the practice?
I think it all depends on the experience that both of our customers are having. But the feedback so far has just been overwhelmingly positive. We have some partnerships with some prominent DPOs and DSOs, and they've reached out and they and literally have told us like, I don't know where you're finding your professionals. I don't know how you're doing this, but this is a totally different experience. Like we love you guys, and so what we're finding is that our dental offices are loving it and our dental practice or sorry, dental offices are loving it and our dental professionals are also loving it. And so we have this like we're creating this kind of marriage, if you will, and both sides of the marketplace are really happy. So we're never going to be perfect. Don't let me mislead you and say that we've never had a professional that showed up that wasn't what they wanted and wasn't a good fit. We'll never be perfect, but we are set up to be better than everybody else out there, and also we're set up to always be getting better over time.
So, and I know you kind of answered this already, but I'm like super interested in like dual-sided marketplaces, especially from like a marketing perspective. The obvious issue is like the supply and demand, right, that you alluded to before, but do you have any like tips on like overcoming these challenges, as the CEO and co-founder? Like what are you, keeping aware of, I guess, as the market changes? And what are some tips for people that have maybe a dual-sided marketplace that are trying to achieve that imbalance issue?
Yeah, yeah. So, I mean, in any marketplace, we don't even have to talk dental specifically. You've got to get really creative about leveraging growth loops on both sides of the marketplace. So, those growth loops they're kind of are perpetuated by, a great referral program, and then also, having your hands in all the different buckets to fill the funnel on both sides. So, on the professional side, the dental professional side, for example, without giving away our secret sauce, we have our hands in a lot of different areas, a lot of different arenas to be able to fill the top of the funnel. So, Facebook groups, dental schools, we're across every major job board there is. We have incredible funnels to, be able to drip on these professionals and move them through the funnel and express different value propositions. And then, the reality is any dual-sided marketplace, you have to ramp up supply and demand in tandem, because if you get one side too far off, the quality of the experience on both sides suffers. And so we're very diligent about making sure that we have the supply. And when I refer to supply, I'm referring to the dental professionals in the industry, that to be able to fulfill the demand. So we'll never launch a market or take on new business if we don't definitively know that when they post a shift, it's going to get filled. And so we have certain benchmarks on the professional side, a certain number of hygienists, certain number of assistants, certain number of receptionists before we'll ever turn on the demand side. So we ensure that experience is great on both sides of the marketplace.
Yeah, that's amazing, because really ultimately it's, you have to make two sides happy. So I
Exactly.
applaud you doing that.
Yep.
No, I think this is super, super interesting. I mean, the obvious issue with most of these is the recruitment and retention, right? And finding that skilled pool of professionals that can be there on demand. So, are there any, again, without giving away your secret sauce, is there any, tips that you've found to be successful when you're like trying to find people to be employed, or to be involved in Toothio? Or are most people just like running for an opportunity like this?
We've certainly seen a lot of people running for an opportunity, but I think there's two kind of key points here. One of our fundamental beliefs is that good people know good people. So it takes me back to that, a really strong referral program, and we don't target everybody for that. We specifically target our highest rated dental professionals, and the whole goal is, let's take our highest rated top hygienists and let them introduce us to their network, because more than likely their network is going to be stronger than others. So, the quality of the professionals that they refer our way are going to be a higher quality. And we've seen that play out when we do analysis of our referral program, and then what the ratings of those professionals are over time. The ratings from the higher rated, or the referrals from the higher rated professionals, are actually also higher rated professionals. So we believe that good people know good people.
That's super smart. You're right. And word of mouth marketing is like key, man. It
Yep.
is the key to success. So if people are talking about your business and they're happy, then more people will follow suit. So
I think you have an opportunity to train people that are new to the industry because, if they're looking to really work hard and they want this opportunity to work with Toothio, I think that you guys, you have that secret sauce. You have the people that are strong in the industry that can help them understand the expectations and the standards you're setting, and it'll just help you guys funnel in even more experts to load into Toothio. And I'm like sitting here like trying to brainstorm with you, Ian. Like, I think it's really great what you guys are doing, and I'm excited to see where you guys continue to grow. And where are you guys right now in the U.S.?
So we're currently in Phoenix, Arizona, Las Vegas, Nevada, Austin, Texas, and Dallas, Fort Worth. And then coming soon, we have Chicago, Orlando, Tampa, potentially LA, and then New York City. So we've got a few big markets that we're going to be rolling out here over the next 6 to 8 months.
Wow. Well, I'm in Chicago, so I'm all for it. Let's
Yep.
let's improve dental care. Um,
Yes.
all right. Well, I really enjoyed having you on today's episode, Ian. I think it's great what you're doing with your company, and we're excited to see where it takes you. And if you would like to learn more about Toothio, you can visit toothio.co, and don't forget to subscribe to our podcast or comment below if you have any questions for us. Thank you.